Hello everyone, my name is Doménica Pinto and I'm going to talk about Empyema necessitatis. First we're going to start with a definition. What is an Empyema necessitatis? It is a complication of the pleura and it is characterized by the extension of purulent fluid through the parietal pleura into the chest wall and its surrounding tissues, affecting this. Here we have a video showing what is an empyema by a doctor specialized in the field.
Empyema is collection of pus in our chest cavity. When I say chest cavity, it means inside the chest but outside the lungs. Empyema is collection of pus outside the lung, inside the chest cavity, between the lung and the chest wall. There are various causes for empyema. In our country, tuberculosis is a very common cause which often affects young individuals and they develop empyema because of tuberculosis. Otherwise, pneumonia worldwide is the commonest cause of empyema. So what happens is when you get pneumonia, which means infection in a part of the lung, there is swelling of the lining around the lung and chest wall, and it starts releasing a lot of extra fluid which collects around the lung. It often leads to collapse of the lung, which could be partial or total, and that fluid collects there, and in course of time it becomes infected and forms an empyema. This is called post-pneumonic empyema. The third reason could be after trauma, after accident, after surgery. Those are less common causes. So after pneumonia and tuberculosis, these are the two commonest causes of empyema in our country.
Now, applications in medicine. We can say that the most common cause is a bacterial infection, but it could also be produced by a trauma or a previous surgery. The treatment consists in a closed or open drainage of the pleural space when the patient arrives to the clinic, but it should be treated as well with antibiotics so that he doesn't suffer of these anytime soon. And some of the causative organisms are Mycobacterium tuberculosis, which is the most common one in 80% of the cases, Actinomyces blastomycosis, Aspergillus, Nocardia, Mucormycosis, and Fusobacterium.
So I just dragged this over here for you. Empyema is next. This represents this little fluid-filled sac right here. Can you guess what this is? Can you guess? Can you guess? Okay, we're talking about the lungs. And as you can see, this is pointing here. So we're talking about the respiratory system in the lung. We have our pleural-filled sac. All right, here, this particular infection is basically a fluid in between our pleural space that has an infection, a bacterial infection, and dead cells together. So it's going to be foul smelling and it's going to be pussy and yellow. Through this process of helping our patient, we are going to drain this fluid right here. Also, we are going to administer antibiotics as prescribed. What are the causes of empyema? Well, first and foremost, the opening of our chest cavity or some sort of invasive surgery can cause bacteria to get in to our pleural space, the pleural space of our patients. Also, trauma, sort of chest trauma. Essentially, we will see a lot of the same causes for different types of bacteria and diseases. Some of them are treated similarly, some of them are treated differently. But to cover your basics, we are talking about bacteria when we get into pus and things like that. Also, trauma can do this as well. All right, let's continue on to the next subject.
Now, some of the pros and cons. We know that this is a very rescuable situation, but it is also very easy to acquire. Here we have 3 videos. The first one shows what is an empyema, what is a pulmonary effusion, and then we have the diagnosis of this empyema explained by the doctor we saw before, and also the treatment of the empyema. Let's watch.
Okay, a lung abscess is a localized area of pus somewhere in the alveolar tissue called the parenchyma. Here's a picture of the lung abscess within the parenchyma or alveolar tissue in the lung. It might develop just because of aspirating some kind of foreign body or following bacterial pneumonia, or because of a mechanical obstruction in the bronchi, like a tumor. The signs and symptoms of a lung abscess, you're going to see fever and chills. You're also going to notice some weight loss in the patient because of the trouble with the lung. Okay, sorry about that. Phone rings every now and then. All right, you're also going to start noticing in this patient some chest pain, a productive cough that because of the irritation that the abscess is causing in the lung. You also might start noticing some dull or absent lung sounds, especially over the area where the abscess is. To diagnose it, we're going to get a chest x-ray and a CT scan, and you'll be able to actually locate and see the abscess on those scans. A blood and sputum culture is going to let us know what's causing it and see, really how much of the lung tissue is involving. A thoracentesis is going to be drawn, and then we'll send that fluid off for analysis to see what has caused it and see what we can do then to fix it. To treat it, we'll do some postural drainage, and we'll learn about postural drainage here in a little while, but it's in your book if you want to go ahead and look it up. Antibiotics can also be given, especially because typically it is going to follow some kind of infection, or it's going to put your patient at risk for developing an infection. So giving them antibiotics can either help treat it or prevent further infections from occurring. If it's really severe, potentially a lobectomy might need to be performed. Here's a picture of a lobectomy where they've cut out the top lobe, the upper lobe of that lung. They also can do wedge resections if it's not very large, and that's where they go in and they just cut out a piece of the lung. There it is right there. Typically they won't end up having to do a total pneumonectomy, but here is a picture of what a total pneumonectomy looks like. Okay, here's postural drainage. There's different postures you can put a patient in just to promote different drainage, and we want to put them in each position for a certain amount of time just to help stimulate the lungs from emptying. So to stimulate emptying of the right upper lobe, we're going to put them sitting up. The apical segment of the left upper lobe, we'll put them hunched over. The right middle lobe, we will elevate the foot of the bed and turn them on their side. Same with the left upper lobe. The right lower lobes and left lower lobes, we turn them on the affected sides and then drop them down as well. All right, let's look at empyema. This is just a general term, and it's talking about any kind of pus in the body, but we are really looking at in the respiratory tract. So when we're talking about empyema in respiratory, we're looking at pus in the pleural cavity. It might be caused by chest trauma, pneumonia, or tuberculosis. Here's a picture of the pus that's forming in the actual pleural cavity, and that's pretty nasty to me whenever I think about that, what's actually happening in that lung. The signs and symptoms of an empyema is fever, chest pain, dyspnea, anorexia, malaise, diminished or absent lung sounds. All of those things are caused just because of the amount of pus that it's clogging and occluding and causing so much irritation and discomfort for that patient. The only way to treat it is either to do a thoracentesis or a thoracotomy. The thoracentesis we've talked about several times, where they insert either a needle or a tube to drain out that fluid. A thoracotomy is a lot more invasive, and here this picture is showing a thoracotomy. They do a surgical opening of the thorax. They insert a chest tube for drainage, and once the pus is drained, eventually the temperature is going to drop, their symptoms resolve, and hopefully it really helps. The thoracentesis can be used also just to further diagnose what's causing the problem, and if it's bacterial in nature, we can then just give broad-spectrum antibiotics or specific antibiotics if we're able to get a culture to show us specifically what has caused this in the patient. All right, I'm going to take a break and we'll come back and we'll look at the influenza.
The patient can have chest pain on the involved side, patient can have cough, patient can have fever, and patient can actually start having symptoms of septicemia, that is, they become toxic, they become sick looking, and in advanced stages even the blood pressure may start falling. So commonest symptoms are shortness of breath, cough, and chest pain with or without fever. How do you confirm the diagnosis? Well, in a suggestive setting, we do a chest x-ray, and the chest x-ray will show presence of fluid in the chest, and it will be confirmed by ultrasound that yes, this is fluid and not some other cause. And then later on we do a CT scan of the chest, which confirms the presence of pus between the lungs and the chest wall. Conventionally, people have done this procedure by open method, in which you give a big cut from front to the back, you cut the muscle, you cut the ribs, and then get enough space to be able to put your two hands inside the chest. And then you remove the layer, you remove the other layer, you remove all the pus, you do all that operation, get a clean condition, get the ribs back in normal position, sew it up with thick stitches, and then you close the muscles and skin. It works well, except that patient gets traumatized very badly because of the cutting of muscles, cutting of ribs, breaking of ribs, and all that stress of the procedure. For the last 15 years, we have been practicing keyhole surgery for empyema patients, wherein instead of making this big cut, we give 2 or 3 1 to 2 centimeter size cuts on the chest wall. Instead of putting our hands inside, we put a camera with a telescope inside, which gives us a vision on the television monitor, and we put very specialized instruments by which we can carry out the same operation without needing to put our hands inside. I must clarify that the extent of operation, whatever we do, is not compromised. It is the same, but the method of doing that is different. Instead of putting your hand, you put teeny mini instruments inside and carry out the procedure. So it takes more time. Sometimes it takes double or triple the amount of time that you take in open surgery, but I think it's a time well spent, because it means less blood loss for the patient, it means quicker recovery, it means less pain in the post-operative period, less requirement for painkillers and blood, much better recovery because your lungs are not traumatized badly, you recover much faster, you are discharged from the hospital earlier, and most importantly, you can return to your normal life in a maximum of 2 weeks time after surgery, whereas after an open surgery, it may take up to 2 to 3 months to be able to do that. We handle a lot of empyema patients for surgery referred to our center, and I'm happy to inform that in majority of our patients across various stages of empyema, we are able to do complete decortication by VATS, that is the keyhole method, benefiting most of these patients. I'm also happy to inform that because of the completeness of the operation that we do, in most of our patients, the chest X-ray looks nearly normal about 6 to 8 weeks after surgery, as you can see in X-ray of one of our patients here. Should you be interested in having more information about empyema or its treatment, kindly visit our website www.drarvindkumar.com.
Now, pros. The pros is that the mortality rates have dropped severely since the arrival of antibiotics. This occurred because the bacterial infection was, as we know, the most common cause. And another pros is that this empyema is easily treatable. We only need to make a minor intervention on the patient with the drainage of the fluid, and that's it. But some of the cons are that it could also be easily acquired, or because of the exposure to these pathogen agents, or because of a surgery that was not followed by an antibiotic treatment. In children, they acquire it the most, and the most common reason is the poor oral hygiene that they have, causing not only respiratory problems but also digestive complications. Issue applied in Ecuador. In this country, Ecuador, out of all of the clinical cases of lung disease, the 30% present empyema, 90% of which are of bacterial etiology. It is mostly present in elders and children than in adults, and it affects more to men than women. This information was taken from a study made in Hospital Teodoro Maldonado Carbo. And as a conclusion, we can say that empyema necessitans is a common complication mostly caused by bacterial infections. Let's notice that infections have a high mortality rate in Ecuador and in tropical countries. And these infections, these problems, empyema, they can be easily diagnosed as it is very noticeable. You can really see in the patient like a bulge, I think it's called like that, in his chest, which indicates the presence of empyema, and it is easily treated by the minimal intervention that I told you about. However, it is very easy to acquire, mostly in children, in whom we should focus, so they do keep a good oral hygiene and prevent empyema. Well, that's it. Thank you for your attention.